right now. Perfect. You will have here next to me, you will speak about the interest of Froggy Mouth in improving involuntary mouth opening and tongue protrusion in children with narcolepsy. I think that you're about to have here next to me in a couple seconds. It is such a pleasure to have you there. We are knowing each other since a pretty long time. I see that you're already sharing your screen. Michel, it is your turn to start this lecture. I let you speak.
Thank you very much, Guillaume. This is outstanding day, I must admit. I've been connected this morning and it's been going on for so many interventions, and I'm totally convinced about Froggy Mouth. And I want to show you here some particularities maybe of the use of Froggy Mouth in some rare diseases. I'm a child psychiatrist. I've been working, and it was a pleasure for me and an honor to share some scientific interest with Patrick Felus, who brought up the Froggy Mouth technique in our hospital. And we said once, why not using it to help these children with rare diseases, such as narcolepsy? And I'll show you why narcolepsy is a matter for us. So I coordinate this Center of Rare Diseases and Narcolepsy in Robert Debré Hospital in Paris. And as Marc just said, vive la France. So I have no conflicts of interest for this presentation. And I want to remind you here, narcolepsy is a rare disease, but it's not that rare. Actually, we have like 300 children with narcolepsy. It usually starts at around the year of 5 years old, up to 12. And it's a disorder for life. You don't come out of narcolepsy because it's a neurologic disorder. And so the prevalence is not that rare. So if you see in your practice a child who is very somnolent, who has excessive daytime sleepiness, because that's the main feature of this disease, and who has sleep attacks, you have to think straight away, does this child has narcolepsy? Especially if he was totally normal beforehand. Narcolepsy occurs during the development, and sometimes it occurs after a specific event like vaccination or infection or things like this. And our interest today is more on cataplexy, because cataplexy is another main feature of this disease. And cataplexy is a loss of tone, a very abrupt loss of tone, and also it can affect the mouth and the face, and this is very striking in children. There are other features like sleep-related hallucinations, sleep paralysis, night sleep problems, but this is not really the topic today. We know what narcolepsy is about. We know that the orexin neurons are lacking in this disease. We've been knowing this for about 20 years. And you see here, these neurons are located in the hypothalamus, lateral hypothalamus. And if you have narcolepsy, these neurons are gone, or maybe they are dead, but they don't produce orexin or hypocretin anymore. And if you lack hypocretin, like these people here, narcoleptic people, we can measure a hypocretin in the CSF. There's absolutely no hypocretin left. So if you don't have hypocretin or orexin, it's the same thing. Well, you don't have a possibility to have a good balance between sleep and wakefulness, because these neurons, they project almost everywhere on the brain, and also they trigger the other systems that are implicated in maintaining wakefulness, like dopaminergic or norepinephrine system. But what I want to show you here is that there's also a pathway down to motor neurons, and if you don't have orexin here, you don't have a feedback in the amygdala, and you may have some cataplexy if you have a strong emotion. We'll go back later. This is a child with excessive daytime sleepiness. He came to the consultation. You see, it's impossible to wake him up, and he has been sleeping like this for about 4 weeks. So he has a very abrupt onset of the disease. Now, it's the same child. He's an 8-year-old child, and he can't even stand up properly because he's almost falling asleep. This is not cataplexy. This is because he can't stay awake properly. So this is very impressive. So if you see a child who's very sleepy, please refer him to a sleep center. This is not a child who developed narcolepsy after being vaccinated in 2009 after H1N1 vaccination. You see he's already put on weight here, which is very abnormal, but it's common in narcolepsy. He has difficulty breathing, probably. And if you record this child in the sleep lab during the day or even during the night, what you see here is the onset of REM sleep, rapid eye movement sleep. This is a very characteristic feature of children with narcolepsy. So this is what a cataplexy is. You see, the child is laughing, he's receiving a trigger, he's happy here, and he starts his cataplexy. So it's here in the neck, in the shoulders, and then if the stimuli continues, he may fall down to the floor. And it's as long as the stimuli is going on, he may be experimenting cataplexy. This is the case of this child here. So he's speaking with his mother, and then boom, he has a drop of the neck and the head immediately. So this is a dramatic cataplexy. He can't even sit down properly. But he's not asleep. He's just experiencing cataplexy. So how do we treat these conditions? Well, normally we treat these conditions with medication, pharmacology. So we try to increase the wakefulness in the children by giving some stimulants, modafinil or methylphenidate or others. And we try to use anti-cataplectic to reduce the cataplexy. But there are no specific treatment for this very particular thing that we see in children, which is the narcoleptic phase. You can see here, this very good paper was published in Brain some years ago. You see how the face is hypotonic and the mouth is open and the tongue protrusion is very abrupt and important in these children with narcolepsy. They were perfectly normal before the onset of the disease. So this is an example of a 6-year-old girl. You see, she's focusing on a task and she experimenting this tongue protrusion almost each time she's performing the task. So this is very specific. This child has the same problem here. It's performing a task here, video game. And you can see the active movement of the tongue. And the opening of the mouth is almost constant. So it's very disabling for the children and it's very embarrassing in the classroom. This one is even more spectacular. He's watching a video game. Now he's going to have a complete cataplexy. He's having a complete cataplexy of the neck, shoulders, everything. And then he will go back to normal. Right, he goes back to normal. So it's reversible cataplexy, but it's very disabling. So with Patrick, when Patrick was in the hospital, we tried to use the device, the Froggy Mouth. I think this is the first time when we use Froggy Mouth to try to cure this phenomenon of the tongue protrusion, because there's no specific treatment for this, and the medication doesn't really help this condition. So this is after wearing Froggy Mouth for a few months. I think Patrick is asking the child now to swallow properly. Okay, aval ta salive means you have to swallow. And as you see, he counts in French, which is a good sign. So then we came out with this paper. Of course, it's only a case report, but I think it was very encouraging to use Froggy Mouth in children with narcolepsy or maybe other disorders. And this girl she's I think 6 when she was seen for the first time. And you see, she's already has put on weight, and she has like these big cheeks that she didn't have before. She has the tongue protrusion, the mouth opening, And also she has a severe incisive open bite here that has been treated just with a non-invasive device, the Froggy Mouth, that she wore for 3 months, every day, 15 minutes in front of a screen. So it was very easy to perform this technique in this girl with narcolepsy. There was not a problem at all. And this is the result that was obtained after 18 months later. You see she's a bit grown up, and this is a total improvement of her open bite here. It's very spectacular. And this is what we get when Patrick sees her. Right, she gets a bravo from Patrick, so it's a very good sign. I think she's almost cured, and she recovered not only from the open bite, but also from the tongue protrusion and these very specific aspects that she had because of the narcoleptic phase. So our conclusion at that time was that Froggy Mouth had shown good efficacy and tolerance in rehabilitating children with trunk protrusion in a very specific condition, which is narcolepsy with cataplexy. And of course, it's helpful. We've heard it all day long on the normotypic children, but also it might be very interesting in children with specific diseases and even rare diseases. We need further studies, of course, because we need larger cohorts. And I think we have to carry on with this very interesting device. And as Guillaume said, we want to rendre hommage here to Christian, because he was really a pioneer in our field, not only for sleep, but also for orthodontic and sleep disorder during sleep. And we miss him very much because he was such a great person and such a great researcher. Thank you very much.
Merci beaucoup. Thank you very much, Michel, for this lecture. I think that you will soon appear next to me.
I'd like to be next to you.
No, not there yet.
Okay.
My team is about to send me their different lecture, the questions that we might have received. No, Michel, you are there. Way better, way better. I was wondering. I think that it's very important to have this kind of lecture. You were part of the same team at Robert Debré than my dad. That's where we were meeting each other. That's why I was also having the chance to meet you. That I have to say was very useful in current times. I think we know, I know, you know, they don't know
what we know.
We know. We are not having any questions for the moment in the live because we are speaking, of course, about a very specific subject. But I know that there is a lot of people, especially in Asia as well. But we have to say that it starts to be a little bit late right now for them that are very interested about all this aspect of the sleep apnea. Asia is, of course, a big field of the research on. I'm speaking of sleep apnea, but narcoleptic, and I speak about all the sleep disorders that children may have. I remember that Christian Guimino was making one of his last studies in Taiwan, I think, if I am not mistaken. But once again, it starts to be a little bit late for them right now. And so that's why your lecture will be available in replay on the vFears platform for the next 3 months. It is one of the lectures that will be available. So for all the people that are watching us right now in replay, just to let you know, it is 9 o'clock. We are in live since already 13 hours.
Congratulations. You did some terrific work here. Terrific job.
Thank you very much.
You're fantastic.
And so it is a publication that is right now done on the Facebook group of the Congress. Feel free to join the Facebook group of the Congress. It is called Froggydays Participants in Congress. There is a publication with each lectures, and you can ask directly to Michel all the questions that you might have about his lectures, about the wonderful cases that he was showing. I have to say that when we were working on the presentation, I was especially impressed by some of them, and also on the impact that Froggy Mouth might have on all those cases. And Michel will directly answer you on this Facebook group during the next 3 months. I am
Great pleasure. Yes.
checking that. Everybody is saying that it was very interesting. They are thanking you, but there is no question yet.
Maybe I want to just say one thing, because you are very a specialist seeing children. When you see children, if you see a child who is sleepy, please refer the child to a sleep center, because he may have narcolepsy, he may have hypersomnia, he may have any kind of disease that has not been yet diagnosed. He may have obesity also in the neck, and he may be treated for this by Froggy Mouth or other devices. And I think it's very important to refer these children as soon as possible. So that's my word.
And you are doing very well to do that. Maybe it's something that we should also add on the Facebook publication to make as much people aware of this very important prevention message. That's also one of the chances that we have during the Froggy Days, having such a great and wonderful audience. And it's the best way to share a very important message for public health. Michel, it was such an honor to have you as a speaker. I thank you so much to have taken the time for this lecture.
Thank you, Guillaume. Bye-bye. Thank you.